Okay, good evening, folks. We're going to get started soon. But what I wanted to do while we're waiting for people to log in is just take you guys through the patient focused certification website real quick. We're going to be talking about regulatory inspection preparedness. And for those of you who are operating cannabis businesses or interested or currently working on one, and you want to get a practice regulatory inspection with a report, an assessment, and why that's important is going to make more sense. But you simply go to the website and you click on this apply button, and you put in some information, your name, company name, and there is a section there for you to list perhaps what you're in, what you're interested in, advisory services, for example, and then perhaps any other information you might want to put in terms of what you're looking for and your infrastructure and things like that. So go in here, fill in some boxes, give us your contact information, and tell us what you're interested in. And if you're interested in a regulatory inspection service, it's what we provide. We've had a lot of success with this with clients who get the phase 1 license and then they have an assessor come. Our last person we worked with in Maryland, basically we showed up a week before the state, went through their facility like an assessor would or an inspector from the state would. And then they basically, the turnaround time when the state actually showed up was only 2 days before they received their phase 2 license to begin production. So it is already kind of showing to work with some of our clients. And so we wanted to share this information with other people and perhaps get more people interested in being prepared for a regulatory inspection. What raids were in the past are what regulatory inspections can be now. They can be the beginning of the end or perhaps the end of the beginning. They could go really well, or they could go really poorly and give you just, it could be filled with headaches. So this is our webinar. It's called What to Expect When Being Inspected. And my name is Jehan Markua, and I'm the Chief Science Officer at Americans for Safe Access and the Director at PFC. I'll be walking you through how inspectors think and what they're looking for. So I always like starting off presentations with a quote, and the quote today is from James Carse, a notable philosopher, who said, "To be prepared against surprise is to be trained. To be prepared for surprise is to be educated." This is why training and education is important. Is training will allow you to respond to a surprise, say a systems malfunction or a medical emergency or a safety emergency on site. Training will prepare you against those. But knowing what surprises to train for comes from education. And you're going to want to look for a group that's going to train you and educate your staff and management well. I think one of the most important questions you can ask is who is held accountable for the outcomes with training and education programs. And we'll discuss that a little bit more on how it relates to passing inspections at the end of this webinar. So what we're going to talk to you today about is kind of some background about inspections, how investigators or assessors prepare for inspections. We'll talk about how the inspection ends, how it begins, or begins and ends. Talk about common deficiencies for cannabis operations. We're going to use real-world citations, including a $1.9 million fine for a cultivation site for exposing their workers to unsafe conditions and being unable to produce policies or documents within 4 business hours. We'll also talk about strategies and tactics for a successful inspection, and we'll end with some resources to help you with that. So first, I'd like to start with a poll. We're going to launch our first poll here. And I want you to select up to, I think this should allow you to select up to more to one answer, but here is, what are your biggest concerns about cannabis facility inspections? And if you don't own or operate a cannabis operation, you can use your imagination. But you want to check, is it non-compliance with your own policies? Like maybe you filled out an app and said you're going to follow pharmaceutical standards. And when the inspectors show up, you're actually not following pharmaceutical standards because you're treating it like a botanical medicine. That would be non-compliance with your own SOPs. Is it don't know the answers to inspectors' questions? Lack of consistency of inspectional approach between investigators, or you will not be prepared for it when an agency comes to inspect. We're going to leave this open for another couple minutes. I see about a quarter of you have voted. See, about half of us have voted. I'm going to keep it open for another 30, 45 seconds. So we have about 70% polling in. Some of you, I guess, may be calling in by phone. And I'm going to close it in about 15 seconds here. So if you haven't voted, hurry up and list your biggest concerns about cannabis facility inspections. Okay, so I'm going to end the poll. And look at that spread. I'm going to share the results with you guys. So if you can't see it, please let me know, but you should be able to see it. So what are your biggest concerns about cannabis facility inspections? Well, a three-way tie between non-compliance with the facility's own standard operating procedures, won't know answers to the inspector questions, and a lack of a consistency of inspectional approaches between investigators. Won't have complete documentation, will not be prepared in general, we're lesser scored. But it's interesting, three-way tie with about 75% of our participants polling in. Very interesting, interesting. So, making sure people are trained in following your own SOPs, knowing how to respond to an inspector's questions, and also not knowing what to expect from an inspector. Very interesting stuff. Thank you, guys. Moving on, there are four major types of inspections. So there's a pre-approval inspection. Like if you're in Maryland, you know what these are about, right? They show up, see how your build-out's going, and they approve you to actually start working with the products, right? Then there's post-approval. We've given you a license, and now we want to see what changes are happening over the next year or so. Maybe are you following your application or are you not? Then there's surveillance. That's mostly what a lot of what PFC and our partners and our accreditation partners we do. We do checks to make sure that folks are working once you get past the pre and post approval process. Then there's for cause or directed. This is usually adverse events or complaint driven. This is another thing where PFC has helped reduce liability for several companies. Is you might get a for cause or an inspector coming based on adverse events, based on complaints about your facility. So when we talk about pre-approval inspections, the purpose is to assure that the operation is capable of producing whatever it is it wants to produce, right? And that the submitted data, the data you've submitted in your application is actually accurate. If it's a big fat lie, you're in for a big fat fine. So it's fine to have changes, but those changes and deviations from what your application, what your intent is, has to be documented and justified. So here's a little pie chart. This is actually from the FDA inspection program. And so I've been borrowing some of their information that is applicable. So here might be an application in 1/4 of the pie, right? Are you ready for manufacturing? Are you ready for producing? Are you ready for distribution? How are you going to address these things? Your procedures? How feasible is your process? What are you going to do about contamination? How will you handle these materials? And how will you investigate any issues? Secondary to that is, well, are you following what you said you would do? You wrote down exactly what you were going to do. We're going to follow pharmaceutical standards. We're going to produce the best cannabis in the world. You better have some scientifically valid data to support that. And if you don't have good data, that is, and you're not tracking changes, you're not writing down what you're doing, that's a big data integrity issue. And they're looking for those things in pre-inspections. Can you track batch records? Can you track employee training records? Do you have a system for reporting worker illness and worker injury? Post-approval, these really are looking, these are more, again, right after someone might get a license to operate, they're looking for changes in production and control practices. And it's usually based on recommendations or risk. Maybe you're informed the state you're making a new product or using a new extraction technique. But basically, it's based on your kind of history. So a post-approval inspection, right after getting approval, might be based on what happened during the pre-approval inspection or your past history of business. If you have a history of non-compliance, you're definitely going to get a post-approval inspection, right? It's based on your past history and past inspections. Then there are my favorite, which are the surveillance inspections. And these are kind of a new paradigm for inspections. And this helps advance product safety because this is a standardized approach because you're gathering data to kind of create a quality intelligence. And this keeps track of positive and negative behaviors. And so basically you can come with a checklist and have semi-quantitative scoring to allow comparisons between, say if you have multiple sites, you want to see how they're doing, you can create scoring criteria for that. And so when we talk about these inspection strategies, there's two really. It's full and abbreviated. And so full inspection is going to be your initial inspection. So you might get these pre and post approval licenses. They might vary in how intense they are. They might be an abbreviated inspection. And so when you're doing a full inspection, it's generally your initial inspection from the state. It's going to look at your history of non-compliance. It's going to look at any significant changes from what you're actually doing compared with what you say you're doing. It's going to look at any technologies, especially new ones you're looking at, and any follow-ups to warning letters or adverse events or complaints. When not using the full inspection option, we're talking about these are abbreviated inspections or surveillance inspections, and these are generally for routine coverage. And so really, this is just to kind of give you an idea about, when they're looking at systems, they might just look at potentially one or two aspects of the quality system, or they might do a full one. Generally, they'll notify you of the inspection before they come there. So before we kind of talk about rationale and what really happens in inspections, I'm going to launch another poll here. This one is, what was the reason for your last inspection or assessment? Maybe you've worked for cannabis operations, you've worked for other businesses. What was the reason for your last cannabis-related inspection or assessment? Was it pre-approval for a license? Was it a surveillance inspection, like just a spot check, a partial assessment? Was it for cause of a recall or adverse events? Or not sure? You're not sure why they showed up. Or you never had a regulatory inspection for cannabis. Already have a third of everyone voting. That's great, thank you. And so, if you're probably from Colorado and you got a funky test result, you may have had an inspection, a short one from the city. And this could include electrical inspections and things like that. I'm going to keep the polls open for another 30 seconds. Just under 70% of folks reporting in. So pre-approval for cannabis licensing can also be seen as mandatory required inspections as well. They're not necessarily triggered as well. So we actually, okay, closing the polls in 5, 4, 3, 2, 1. To share the results. Very interesting results. So we do have some people who have had their pre-approval for cannabis licensing inspection. We've had someone who has had surveillance, but overwhelmingly 80% of the participants in this webinar have never had a regulatory inspection for cannabis. That's a frightening prospect. If you have never had a regulatory inspection before, much like never done, roller skating for the first time could be kind of painful if you've never done it before or had any guidance. So this is a very fascinating, interesting idea. So this is definitely a deficiency, I would say, in terms of training or at least an area to get people more experience with that. And so hopefully with the rest of this, we'll remove that mystery a little bit of the regulatory inspection. I like to say, if you want help with this, ASA, PFC, through the PFC program, can provide a regulatory inspection for you ahead of inspectors coming to your facility so your staff can understand how that works. And the great thing about ASA and PFC services is it's the only services to the cannabis industry where the money goes right back to patients. It goes right back to expanding access, to fighting the DEA, to passing the CJS amendment to defund the DEA's activities, to getting rid of condition-based lists, and providing education. And you can tell that guy on the horn approves. So what really happens at these sort of inspections? So cannabis facility inspections are an official examination of a facility, and their intent is to determine compliance with laws and other regulations. These are fact-finding, they must obtain evidence, and they are regulatory. And another thing is, they're going to be reasonable in terms of time, limits, scope, and the manner in which they're conducted is to achieve the objective of the inspection. When you talk about who's going to be showing up to inspect, well, largely in my experience in the ride-alongs I've been in and working with different state programs, it's largely former law enforcement or ex-military police. And they're specialists and experts in diversion and things like that. But they might also have backgrounds in chemistry, microbiology, process or facility operations, as well as formulation. So you could get one or two guys or gals showing up to your facility, one perhaps former law enforcement, and one might have a science background. Your inspection plan is going to be based on, number one, your approved application. Are you following through with what you said you're going to do? And if you're changing that, have you documented and approved those changes appropriately? It's going to be based on other EIRs, other established inspection reports. Say you're a PFC company. You're going to have an inspection report already available for them. Perhaps it's for 483 violations. Perhaps you don't have validated cleaning protocols. And the health department's already been in there saying, hey, you guys haven't validated your sanitation plan. You haven't provided training to your employees, your quality control plan, the way you analyze your cannabis for your in-house lab. None of those methods are validated. You don't have good control of your documentation. Those are 483 violations. And they're red flags. And you have enough of those, it can trigger a full assessment or even the operation be shut down while it fixes that. Another thing they use is websites, literature, press releases. What you say out there and what people say about you can sometimes affect it. If you're out there advertising that you're making a product that isn't allowed in your state, you're asking for trouble. And it's also going to be based on consumer and community complaints. So these are all the things that an inspection plan can be based off of. So if you don't have previous citations, okay, so the 483 doesn't apply to you. But if you don't have a website, you don't have literature out there, you don't have press releases out there, then they're probably not going to look at those. I look at all this stuff before I do a PFC assessment. I go to your Twitter pages, I go to your Facebook pages, I go to your web pages, and I look in the news and see what's going on. But another thing, one way to protect yourself is to actually ask for inspector credentials. So always make them prove their identity. Don't be jerks about this. You want to go smoothly, but they are required by law to show their credentials upon starting an inspection. And so just because someone says they're a police officer or Department of Health is not good enough. You want them to display some sort of credentials. It must be the original, cannot be a photocopied badge. And you want management may examine the investigator's credentials and record the number and name. They have to sign into the logbook just like everyone else when they come to visit the facility. And this is just an example of a police badge. You can go on there if you're really interested and look up the 8 different points on how to identify fake credentials for government officials and law enforcement. This is just an example that it's within your rights by law to confirm credentials of the inspectors. And I would definitely do this. I'd have someone check them in, sign them in, just like you might check a patient coming into your dispensary or an employee checking in for work. You're going to check their ID, you're going to log the time in, time out. Another great resource here is the FDA Investigations Operations Manual, which contains a lot more detail on this information. So if you want to look at sort of the gold standard for inspections and what people are generally trained on for the government work, this is a kind of a fun resource if you're a nerd about inspections and safety standards. So inspection begins. You're going to get an issue of notice about the inspection, a letter, an email, phone call. They're going to display their credentials. They're going to state the purpose of the inspection, and they should provide you with a general agenda of what they're there for. This might be verbal. It might come in the form of a document. Hey, we're coming to do a full walkthrough. We're going to do a full assessment. We just want to see how you store the waste, maybe is what they're interested in. And so what you're going to do is give them a tour of the facility, get into some details about what they're interested in. Maybe they want to pull some SOPs. Make sure you can do this in under an hour. You should be able to do it instantly, but be able to pull policies and SOPs or record keeping files. And it can be done electronically. If you can pull it up on your phone and say, here's our form that we fill out, or you can pull it up on a computer screen or monitor anywhere in the facility, that's great. Doesn't necessarily have to be print. And you're going to have a wrap-up. So what investigators are looking for specifically is ways to verify that you are in a sufficient state of control of your operation, of what you're doing, and that you are, they're able to reference regulations, SOPs, and policies. And so basically documentation to support what you're doing. What they're looking for, the number one thing they're looking for, poorly trained employees. This leads to workplace injuries. This leads to unsafe handling of products. And it's one of the most difficult things to do because training is a moving target. Technology changes, responsibilities change. They're going to look for poorly maintained or contaminated equipment in facilities. This includes shovels, any sort of work surfaces, anything that the cannabis touches that should be clean. And poorly maintained and poorly trained employees could either be that, that it's not documented. If it's not documented, it's not happening. They're poorly trained. Or perhaps, I always make up a worker in the facility, I just call him Steve. So you could have Steve in the trimming or processing area, and it may say in the protocol that he's supposed to wear gloves, hairnet, and a disposable gown, and he's not wearing any of that, and he's in there. It would be an example of a poorly trained employee. Or say you hired a third party to train your group that was not accredited and did not meet the state requirements and did not train your people appropriately. It could also be that you have a lack of control in your processes. You don't know, you're just going from A to B to C to D to make the product with no checks in between, and there's a real variable process that isn't controlled. And also, there's no evidence that if you did a deviation or there was a failure with a product, that you investigated those deviations, that you're tracking those complaints. So they're going to be looking for this. If they have a complaint about your product or facility and you have it and you haven't addressed it, management hasn't signed off on the response, that could be looked at as a failure or discrepancy. Investigators can look at documentation. They're going to look at, so here's three things I would say for whether it's a pre-approval, post-approval, a surveillance audit, or a for-cause audit, or whatever is triggering the inspection. They're going to ask first, can the operator produce documented evidence of past events? Producing batches of cannabis, applying growth medium, clonal propagation, training employees, you name it. Can you produce documented evidence of your activities? Second, is there scientific evidence to support conclusions made in reports? If you say you produce the best and safest cannabis in the entire state program, you better have some testing to back that up as just a conceptual example. But if you do say your product is produced to pharmaceutical standards, you better have some scientific evidence to say, yeah, look here, there are 0 microbes, 0 fungus. This is just like a pill of aspirin. It meets the same requirements. Those sorts of things. And it also applies for labeling and things like that. Also, do investigations or training reports demonstrate issues that could affect the quality or safety of the product? Are you keeping track of specifications as products move through the processing. For example, data integrity is can become a big issue. And usually if you see a couple red flags, it means there's tons more. But basically, if you're not recording issues, you're not recording activities, that's the #1 thing they're going to look for. If someone deviates from a protocol, that needs to be documented. It's not a bad thing. It just needs to be documented and approved. Fabricating data to create acceptable test results or copying pre-existing data and transferring it, that's a big no-no. Discarding data or rerunning samples without appropriate documentation. Like, for example, say you work at a cannabis cultivation site and you pull some cannabis samples for a test, you send it to the lab, you get the results you don't like, so you trash those results and you cherry pick some other buds to send to get tested. One is if your data looks too good to be true. That would also potentially signal that there's some data integrity issues. And that's why I always say one of my maxims is use brackets whenever possible. There's no such thing as a 1 or 0 really in science. I mean, there's no 0 and 100% are artificial constructs we use to create a baseline of measurement. So you have to remember that there's going to be a range of accuracy associated with any value, anything. When you go buy medicine, it's not 5 milligrams of an active ingredient. It's 5 milligrams plus or minus a huge range sometimes. Potentially, if you had failing stability studies that weren't submitted, proper filing, and also if you have no raw data, like you don't weigh the batch of cannabis, you don't know how much inventory you have, basic things like this. And this can apply across laboratories, manufacturing, dispensing sites. If you're near the dispensing site, you're not keeping track of scale calibrations and how much things are weighing, you're potentially gonna have a bad time. So inspection findings can, when investigators find that there is evidence that an operation is in a state of control or maybe not in a state of control, that is evidence that they're going to use to decide to what the appropriate advisory, administrative, or judicial action is. So if everything's all good, then the appropriate advisory and administrative action is to say, grant you a phase 2 license or send you a nice report saying, thank you for being compliant. So how can you give them what they want? The one thing is you don't want to give them, I should say, these 5 things. One is a direct observation of an SOP or related deviation. If you say you lock all doors and use key cards on every door, then by golly, you better do that. Procedures. If there is an observed observation of someone not following a written procedure, so say you have a thing on the wall that says all employees must wear this, no smoking, or must wash hands, and they observe someone not following that written record posted on the wall or in an employee handbook, that is a potential violation. If your staff or your managers verbally communicate that a violation occurred, oh yeah, that's our protocol, but we never follow it because we do something different, that would be a violation. You need written records and documentations. That will make them happy if they ask for it. And you also want to remember that the investigators are going to have regulatory notes, and you should have a written record that's created during the inspection to document that the inspection has occurred on your end. And so what are they going to put in the report? Well, these regulatory notes, the reports they're going to send you, they're only going to record observations relevant to violations. They're going to document positive findings and corrective actions, and these should be accurate, objective, factual, and free of personal feelings or conclusions. So if they have in their notes to you in your report that they don't like the way your hair is cut, or whatever your personal beliefs about politics, that is not appropriate. And you have to remember that all this stuff are property of the government and potentially releasable under FOIA, under the Freedom of Information Act. And these are also used to assist future inspectors to refresh their memory and serve as the basis of other reports. And so when inspectors are ending these meetings, they're going to be trying to develop a regulatory note for you. Could be a report, inspection report, but it's going to have an exit meeting. It could result in sample collections of any type. They could, if you're in production, they could take a sample of cannabis. They could take an air quality sample. They could look at any number of things. They may require affidavits in terms of if you're saying you're growing to pharmaceutical standards, they may want that in writing. And there might be issuance of some violations on site. Inspectional observation, OSHA violations, depending on what experts they've brought with them. But usually the violations may come later. So inspections are typically classified into 3 areas. So you might get a report that says no action required at this point. You might get another one that says voluntary action required. Hey guys, you don't have to do this, but you really should use our recommended educational program available on the Maryland page or whatever. I just like using Maryland because it's nearby and they're going through a lot of these things. But there could be some recommendations. Let's just put it that way. Or there could be official action required. And this is, again, low on our our totem pole. You don't want to see that. And again, participants, feel free to post questions. We will open it up to Q&A at the end, but it doesn't mean you can't get in the queue now. So again, when you're talking about pre-approval inspections, you probably will get a conclusion or at least a sense at the end of the inspector's initial recommendation. If you don't, that may not be a good sign. However, if it's post-approval and you're getting like a full assessment, the investigator will not provide the recommendation at the conclusion of the inspection. But expect a copy of the report. And I would also look at the report critically and challenge anything that does not appear objective or may be personal or not related to, say, objective analysis of the operation. So tips for a successful inspection, well, watch out for snakes and scorpions. Don't let them into your facilities. For example, poorly trained employees going through with, like, say, a program for training your employees because it was cheap, but you don't really know what your employees learned, is not a good strategy. It could potentially backfire on you. But remember, the goal of inspections, whether internal or external, is to resolve issues before they become problems. Everyone wins. So one tip is appropriate training and education. Who's accredited? Who's held accountable for the quality of education and training you're getting for your employees? Very important question to ask. If a training group does not have a partnership with an accreditation body or a university, who is held accountable? You also remember that you want to make sure that any groups you're working with are the appropriate groups, and there's issues of quality and outcomes. But basically, a successful inspection, basically you want to make sure everyone involved who's being inspected knows and can comply with the regulations and policies of the state. When you're being inspected, be proactive, have a good attitude, display a willingness to correct problems, but don't make a promise to make a correction if you don't agree or are not positive you'll be able to follow through, right? Like, don't say, oh yes, we'll go and we'll buy liquid nitrogen and a gamma radiation machine. That's a great idea. And then you have no intent of following through. You want to be prepared for the inspection. Again, the simple way for a successful inspection is to say what you do and do what you say, have written standard operating procedures, and train your staff to follow them. And again, feel free to ask the investigator for clarification if you don't understand or agree with an observation. But don't be combative, be proactive, have a good attitude, but you're free to ask for more information. And again, when we talk about this, we're stressing here that your employees need to be trained before you get an inspection, right? If you're coming to see if you're ready to produce and operate and nobody's trained, nobody's been trained to the state regs, nobody's been trained on your SOPs, then you're not ready. And so you want to avoid that being in your history of non-compliance, that you knew months in advance that you were beginning an inspection around this time, yet nobody was trained. There were no approved SOPs or things like that. And so again, really training is one of the simplest ways to ensure a smooth assessment. So we're going to move into our final question before we go and talk about what are the repercussions of these violations. They're not just harmless things anymore given out to mom and pop shops. We're going to talk about real repercussions, including OSHA's top violations at cannabis cultivation facilities, at least the ones that we've been able to track down. So this next poll is going to open up is what would be the most difficult thing in preparing for an inspection. So we're opening up the poll now for a minute or two. What would be most difficult in preparing for an inspection? Ensuring complete and accurate documentation, training all your staff, defining roles and delegating responsibilities to address specific issues or topics, anticipating what the inspectors will do before they arrive, or maybe you're not sure what that might be because you haven't had an inspection before. All right, we already got about almost 40% of folks responding. It's great. Thank you so much. And so anticipating what the inspector will do before they arrive. And I think I set this up so you can select more than one, up to 3, I believe, of what would be most difficult. We'll let it go for about 30 more seconds. All right. Okay. Closing the polls. We got 70% of the vote in. Closing the polls in 5, 4, 3, 2, 1. All right, folks, look at that. A dead tie between ensuring complete and accurate documentation and anticipating what the inspector will do before they arrive. Those are great things to think about. We see that about a quarter of you were concerned about training your staff to follow NOLA regulations and SOPs. Ensuring complete and accurate documentation, that is something you're going to want to have a third party challenge you. Can you produce the documents? And I think that is a wonderful exercise for operations. Also anticipating what the inspector will be looking at before they go there. If you're getting an inspection, I would request that I would look into getting a formal notice, make sure you have that letter. And feel free to ask questions about the scope of the assessment. But again, they're probably going to want to have access to everything. Feel free to ask for clarifications in terms when your inspector arrives. Okay. All right, well, moving on to the basics of citations and penalties in the industry. So there's really 4 types: willful, serious, other than serious, and repeated. And each of these have their sort of various fine and penalty. So again, willful is, again, if you're intentionally and knowingly commits a violation with plain indifference to the law. This could be diversion. It could be manufacturing products that aren't allowed, things like that. Serious could be a substantial probability that death or serious physical harm could result, and that the employer knew. Like, say, spraying your employees with pesticides before they go into the cultivation site because you're not allowed to spray the plants with pesticides or something like that. Just making up a conceptual crazy example for you. Other than serious, again, direct relationship to safety and health, but probably would not cause death or serious physical harm. Each of these violations could be $7,000. Willful violations are a little bit expensive. There's $70,000 with $5,000 for each willful violation. So like, let's say willful violation could be that you set up a temporary electrical system that is really dangerous, and you knowingly did it to power your facility because you couldn't get it, for whatever reason. That could be a huge fine, and we have seen this. And again, if it's a repeat violation, you can get a huge fine on top of for each violation that hasn't been addressed. But have we indeed seen these in the cannabis industry? But I thought it was federally illegal. What would administration agencies be doing looking at worker safety in these operations? Well, good question. Turns out that there have been a few what I would call greatest misses at cannabis operations. So according to Adherence Score, which is an app, in 2016, these are the 5 major OSHA infractions across all cannabis operations, whether they're laboratories, manufacturing, cultivation sites, and dispensaries. 1, no hazardous communication plan. No good labels on hazardous containers, which could be things like bleach, cleaning agents, pH up, pH down. You didn't have the SDSs, the safety data sheets for all chemicals and pesticides. Does THC have an SDS? Absolutely. If you have it on site, you should have the SDS for THC. If you're using cleaning agents on the floor, those need to be in there. Whatever you're adding to the plants, et cetera, whatever is stored. And also hazardous chemical training for employees. Number 1 violation is the written hazardous communication plan. Number 1 violation. And it's a little scary that the number 1 violations are worker safety related. So all relevant employees have not been trained on hazardous materials prior to working at the facility. And that's number 2. Again, the facility does not have required OSHA documentation related to workplace injury on file. This is generally a poster you can buy for as little as $5. Number 3 violation is not having appropriate OSHA documentation. The facility does not have a formal fire prevention plan, which is required in facilities with more than 10 employees. Required personal protective equipment has not been evaluated and documented, along with associated training plans and verification for employees. So literally, the top 5 violations, one of them is that you're giving your employees equipment that actually doesn't protect them in what they're doing because the equipment has never been validated or is not appropriate for use. So here are some quotes from an OSHA inspector. Electrical infractions, and again, cultivation operations are the number 1 source of OSHA violations in the cannabis industry right now, according to a 2017 article and interview with an OSHA inspector. So electrical infractions are often identified, such as connecting lights with temporary wiring, such as extension cords, and fines per inspection have raised between $3,000 and $11,000 for just using 1 extension cord to power lights in the cultivation operation. Another frequent one, perhaps the most common one I've heard about from individual operators, is allowing employees to use respirators without medical evaluation, a proper fit test, or having a respirator maintenance program. This is immediate $2,800 fine if this occurs at an inspection, plus $7,000 per employee. So if you have 3 cultivation sites and 10 employees working at each cultivation site, you're looking at like $200,000 in fines. And again, if you haven't fixed these fines, they're going to add $70,000 per facility that is part of an operation. So if you have 4 or 5 cultivation sites and you get your violations because you weren't prepared for regulatory inspection and you don't fix them or address them, the fines keep mounting. And I'm going to give you my 4 favorite. And these are things I have seen on inspections as well, and we've helped fix at places. But blocked exits, fire extinguisher locations not marked, electrical panels blocked, $156,000 fine for a cultivation site. Investigated fire at facility, they failed to maintain working fire extinguishers, almost a $90,000 fine simply for not checking routinely if their fire extinguishers were filled. You got a little tag that comes on the fire extinguishers as expiration date and requalification dates. They hadn't done that. Failure to guard electrical devices, provide standard railing and handrails. And above a certain height, you have to provide this for your employees. If you don't know what that height is for mezzanines and things like that, lack of an effective hazardous communication plan, exposing employees to electrical hazards such as extension cords and things like that, and allowing the buildup of combustible material, $200,000 fine. failing to report employee illness, exposing workers to infectious bacteria, failure to complete OSHA Form 301, which is related to injury and illness, not recording that, and failing to provide requested records within 4 business hours. These things led to a $1.9 million fine. And all of these also led to cultivation, potentially people, their licenses in jeopardy with fines like these. Imagine what your investors would say if their first inspection resulted in a fine like this simply because you hadn't taken the simple steps of training your employees for regulatory inspection. So, are you ready for an inspection? And so what we've been doing for years is helping folks get certified. So when you apply at PFC, at Patient Focused Certification, what we've shown is we can reduce the risk and liability. We can demonstrate compliance with state and local regulations. That's what our SEAL means. Compliance with botanical safety standards, which are the basis of 20 states for their document requirements and safety and handling requirements. We also provide staff training and education discounts. We help to implement standardized methods. Automatically included with a PFC application or contract are 2 assessments or audits per cycle, per certification cycle. We also offer free advising hours and a regulatory inspection to all of our clients who are certified. So if you're a PFC client and you've already achieved certification, you're going to have the Department of Health show up, you give us a call, and we can get someone down there to prep your staff and do a run through. We also get promotions by ASA. We engage in government relations work. Like I said, we have state contracts, we provide training and education, both to the cannabis industry and to the program administrators. We also do government relation work, like I mentioned, and peer review certification and accreditation. So basically, PFC offers advising services. Like if you are applying in a new state, you want help writing an application, we're the only group where if you pay money for our services, it actually goes right back to activism, right back to expanding access. It doesn't go, to like, I don't know, some lawyer's fund for his watch repair, get his Rolex tuned or something like that. This actually goes right back into expanding cannabis programs and ensuring safe access for patients. We also do an application review process where we'll apply a rubric to your applications. One client just received their license in Pennsylvania. They were the highest scoring application in the state. They went through our application review process. Like I said, we also do regulatory inspections. So if you want to train your staff, we can do walkthrough. We also do full operation certification as well as training and education. And we also do contract research in Europe. So if you have a product that's standardized and you want to actually see what happens in humans or animals, we have partnerships that allow it to happen. So when you're looking at this stuff and getting ready for these inspections or assessments, you want to make sure there's accountability for standards, for certification, for education, for training. Right now, our training is through the University of Maryland School of Pharmacy. Our accreditation that we do jointly with A2LA is ILAC signatory. So whether you need ISO or PFC, we can help with that. Our research arm, we talk about research services, is through the International Cannabis Cannabinoid Institute based in Prague in the Czech Republic. We are also hold a position on the Executive Committee of Assessment, Training, and Credentialing at ASTM International, which is going to set the standards internationally for how cannabis companies are trained, inspected, and et cetera. And so when you're talking to groups about who you're going to get your training, education, and certification from, make sure there's accountability, and make sure that the groups are appropriately accredited and certified as well. Again, so if you want employee management and training, go right now to pfctraining.org. If you're a PFC client, you get up to 50% off on this trainings. And you can take them right now through the School of Pharmacy in Maryland. If you're looking for educational materials for patients, Cannabis Care Certification provides a 2-hour module for patients, as well as we have 22.5 hours of doctor education material as well there. If you want to implement product safety protocols at your operation, patientfocuscertification.org. We can help with this right away. Adverse events reporting. This is the cause of many inspections. Complete product recall program. These are required by the American Herbal Product Association standards that we base our certification on. And if you're looking at standard function and development, reducing liability and risk, improving outcomes, and that sort of thing, this is where our advising services help with case studies, non-FDA claims, and appropriate nomenclature for botanical and nutraceutical products. I want to thank you guys for your attention. For all future events, you can go to safeaccessnow.org/events. We have some upcoming webinars. We are going to have some guest speakers. And so in about 2 weeks, we're going to be doing one of these one of these presentations. One is Writing Applications 101, and we were going to talk about Michigan and Louisiana and their upcoming process, developing regulations and putting out these RFPs. And so whether you're writing an application to provide services for the state or writing an application for a license, we want to educate and provide a webinar on that. Also, we work on another project called Certify It or Die, where we go into more details about fines and employee injuries in cannabis spaces and what sort of injuries people are seeing. Also, we have a program on developing an internal audit program for your cannabis operations. So let's say you have a cannabis lab or a manufacturing or cultivation site, and you want to have your own internal auditing program that you check things. We're also going to have a guest speaker over the summer, Shiv Mukherjee, who's a quality control guru expert. He's travels the world helping to solve quality control problems. He has helped train some of our PFC auditors and develop our quality control and quality assurance training, and we're going to have him do a training one of these days. So these are our 4 webinars we have coming up. You guys attended these. If there's one that really speaks to you, let us know what you'd like to see, and we will we'll make that one a priority. So with that, I'm going to open it up to any questions if there are. Appreciate your attention. I hope this was useful. One person asked, is there a PFC credit for this webinar? If you are an assessor or auditor working with us, or you've taken our training, this counts as continuing education training. We're talking, there'll probably be a couple hours every year that, depending on what your specialty is, it's required to maintain your ability to be a PFC assessor or auditor. All right, well, I don't see any questions coming in through the to the group unless you're talking on your muted phone. But I will keep it open for another minute or two. Remember, there's no question too big, no question too small. Okay, well, we have 5 more minutes. It's all up to you guys. I guess we could, while people are sending in their votes, we could go in and review our results from the last polls. So I'll do this real quick. We'll review the polls, and if there aren't any questions, we'll end it. But when we talked about what our biggest concerns about cannabis facility inspections were at the beginning of this webinar, the top 3 answers were non-compliance with standard operating procedures and related policies, not knowing the answers to the inspector's questions, and lack of consistency of an inspectional approach between investigators. Now, we can help you address some of these right now. One is, if you don't know the answer to the inspector's question, ask for clarification, right? If you're worried about an inconsistency among inspectional approaches, ask for clarification about the scope of the assessment. Non-compliance with SOPs and related policies, that's a training issue. All right, and then we'll move on to the second poll real quick, just to review the answers. So here, number 1 thing, reason for last inspection. 1 person said pre-approval, 1 person said a surveillance inspection, and overwhelmingly 80% of the respondents said they've never had a regulatory inspection or been a part of one for cannabis. Very surprising. And I think it's suggesting that there is a need here to prepare for that. The third poll is, what would be most difficult in preparing for an inspection? The two most common responses are ensuring complete and accurate documentation, So saying what you're doing and doing what you're doing. And then the other one is anticipating what the inspector will do before they arrive. What are they going to look at? How are they going to shape the assessment? So someone asked, anonymous attendee has asked, can you speak to the inspection processes specifically of the Maryland facilities that have already occurred? So very few inspections have occurred. I can only speak to really my experience, and one is that the facilities that we have worked with have experienced a turnaround time of a day or two in terms of approval. I know of one group that decided not to go with our services, and now they're maybe 3 weeks out and still haven't gotten their report back from the state. So what I do know is that folks that are prepared and trained are having a much smoother time. But it's a small sample size. But there's a big rush to get this done. August 15th, all the cultivation operations have to be inspected. You know, we are a patient-focused organization. We want there to be access to cannabis. If you've never had a regulatory inspection before, please consider getting a patient advocacy group out there to do your assessment that helped train the program administrators, helped write the checklist in Maryland that the inspectors use. So again, being prepared, being trained, and having a proactive approach are probably the most important things when it comes to having a successful inspection and the best possible outcome. That is a great question by an anonymous attendee. That is a really good question. I hope I was able to answer that for you. Well, we're 2 minutes before 7:30. Are there any other questions? All right. Well, I certainly have...
There's actually, I'm sorry, there's 2 more questions.
Oh, great. Thank you.
Someone asked, what about diversion issues?
Okay. Ladies and gentlemen, Debbie Churguy.
Hello.
From OHSA. So diversion issues. So I think that this gets down to security, right? And not just having guns on site. This is about security cameras. Can you track what people are doing, right? If someone leaves your facility with cannabis in the pocket, maybe you may not be able to stop them at that time, but you can identify their facial features on the camera. Or, you know, that's just an example. There's inventory control. If inventory results don't match up, you do something. Let me put it to you this way. Here's a diversion question. Well, let's go back and use the guy, my made up cannabis technician, Steve. Let's say Steve has just brought in a batch of cannabis and is required to break it up into smaller amounts for distribution. And upon reconciliation of the yield of breaking up the batch into smaller units, there's a 50-gram discrepancy. That is, he started, let's just say, with 2,000 grams, and when you add up everything that's been prepared for distribution is 50 grams light. What would you do? Do you fire Steve right away? Do you look for, you know, what is your process? How would you address this? It's not diversion yet, but it could be. What is your process for inspecting and reconciling that? Hopefully it'd be something like, let's look at the master inventory log, see how much was taken out. Maybe a sample was taken out and wasn't reported properly. Maybe it dried a lot in the storage room. Maybe it's really old cannabis and it lost 50 grams in water weight, not unheard of. Or maybe the scales weren't calibrated. Maybe the scales are outside their qualification date. These are the types of things you need to be able to do to address a potential diversion. Debbie, do we have another question? But also I'd say with diversion, is also you want to have some sort of training for your employees on how to detect it, how to look for signs of it, and things like that. Sorry, Debbie, what was the next question?
Oh, I was just going to say, someone asked if this presentation will be available later, and I just posted that we will be posting this on our YouTube channel. And if you subscribe to our YouTube channel, Americans for Safe Access YouTube channel, you'll get an email every time we post a new video or webinar.
Yes. Excellent. Okay, well, if there are no more questions, I'd like to conclude this webinar and just say that we can all be reached at ASA. It's basically our first names at safeaccessnow.org. So Jahan, Jahan at safeaccessnow.org. Send us a line. If you like this webinar, if you didn't like this webinar, are there topics you'd like to cover? Are they too long? Are they too short? Are there other types of speakers or topics you like covered? Please let us know. We'd love to know what your opinions are. And again, if you're interested in getting some training, we can do remote live trainings. We can do pre-recorded, or we can do in-person trainings as well. I appreciate all of your time and thoughtful questions, and look forward to seeing you guys all again in 2 weeks at the same BAT webinar, probably at the same BAT time. All right. Have a good evening, folks.